Assalamu alaikum, my dear students. Hope all of you are fine by the grace of Almighty Allah. I am Saima Bonna, Sector 7 EMSS is with you to conduct a class from 7 on Science. We have already completed chapter number 5, lesson number 5, Digestive System. Today we will start a new topic. So let's go for the class. Students, take your notes from the first slide. Chapter number 05, lesson number 6, topic diseases of digestive system. Now we will have a look from our previous lesson. First, digestive system start with mouth, then buccal cavity, pharynx, esophagus, stomach, small intestine, that is duodenum and jejunum, ileum, large intestine and anus. After that we studied digestive glands and their functions like liver, pancreas, gastric glands, intestinal glands, large intestine, these. So from these we have studies all over the digestive system. Now we will study diseases of this digestive system. We suffer from some diseases of digestive system. Our today's topic will be that. Now, my dear students, let's enjoy a video on this topic.
Across the whole planet, humans eat on average between 1 and 2.7 kilograms of food a day. That's over 365 kilograms a year per person, and more than 28,800 kilograms over the course of a lifetime. And every last scrap makes its way through the digestive system. Comprised of 10 organs, covering 9 meters, and containing over 20 specialized cell types, this is one of the most diverse and complicated systems in the human body. Its parts continuously work in unison to fulfill a singular task, transforming the raw materials of your food into the nutrients and energy that keep you alive. Spanning the entire length of your torso, the digestive system has 4 main components. First, there's the gastrointestinal tract, a twisting channel that transports your food and has an internal surface area of between 30 and 40 square meters, enough to cover half a badminton court. Second, there's the pancreas, gallbladder, and liver, a trio of organs that break down food using an array of special juices. Third, the body's enzymes, hormones, nerves, and blood all work together to break down food, modulate the digestive process, and deliver its final products. Finally, there's the mesentery, a large stretch of tissue that supports and positions all your digestive organs in the abdomen, enabling them to do their jobs. The digestive process begins before food even hits your tongue. Anticipating a tasty morsel, glands in your mouth start to pump out saliva. We produce about 1.5 liters of this liquid each day. Once inside your mouth, chewing combines with the sloshing saliva to turn food into a moist lump called the bolus. Enzymes present in the saliva break down any starch. Then your food finds itself at the rim of a 25 centimeter long tube called the esophagus, down which it must plunge to reach the stomach. Nerves in the surrounding esophageal tissue sense the bolus's presence and trigger peristalsis, a series of defined muscular contractions. That propels the food into the stomach, where it's left at the mercy of the muscular stomach walls, which pound the bolus, breaking it into chunks. Hormones secreted by cells in the lining trigger the release of acids and enzyme-rich juices from the stomach wall that start to dissolve the food and break down its proteins. These hormones also alert the pancreas, liver, and gallbladder to produce digestive juices and transfer bile, a yellowish-green liquid that digests fat, in preparation for the next stage. After 3 hours inside the stomach, the once shapely bolus is now a frothy liquid called chyme, and it's ready to move into the small intestine. The liver sends bile to the gallbladder, which secretes it into the first portion of the small intestine, called the duodenum. Here, it dissolves the fats floating in the slurry of chyme so they can be easily digested by the pancreatic and intestinal juices that have leached onto the scene. These enzyme-rich juices break the fat molecules down into fatty acids and glycerol for easier absorption into the body. The enzymes also carry out the final deconstruction of proteins into amino acids and carbohydrates into glucose. This happens in the small intestine's lower regions, the jejunum and ileum, which are coated in millions of tiny projections called villi. These create a huge surface area to maximize molecule absorption and transference into the bloodstream. The blood takes them on the final leg of their journey to feed the body's organs and tissues. But it's not over quite yet. Leftover fiber, water, and dead cells sloughed off during digestion make it into the large intestine, also known as the colon. The body drains out most of the remaining fluid through the intestinal wall. What's left is a soft mass called stool. The colon squeezes this byproduct into a pouch called the rectum, where nerves sense it expanding and tell the body when it's time to expel the waste. The byproducts of digestion exit through the anus, and the food's long journey, typically lasting between 30 and 40 hours, is finally complete. TED-Ed is a nonprofit. If you value our work, please consider supporting it on patreon.com/TEDEd.
Dear students, I hope that you have enjoyed the video. So, take the teaching points, that common diseases and their remedy. Gastritis, dysentery, constipation, care of digestive system, tooth, food and taking food. Now, there is a picture you are watching that is reflecting some burning effect, right? So we can guess which type of disease we are going to discuss. Gastritis. What is gastritis? We will discuss basically the reason, and after that we will discuss the remedy also. Gastritis, the one most frequent diseases of a digestive tract which reflected in all system of an organism. It is gastritis. Like you are watching a healthy stomach and a gastritis affected stomach. So gastritis, why it take place, its after effects and symptoms and remedy will be discussed. Now why the reason behind it, taking food too much spicy and oily food. Like you are watching in the picture, the spicy food as well as oily food. So these are the reasons. Look at these foods, very delicious to look at, but these are very harmful for our stomach. Next is taking meals irregularly. We are taking our meals very irregularly, and that is another reason of gastritis. Whereas result in burning in the chest due to secretion of extra acids. So when these extra acids secrete, that time we feel a very different type of situation. Result in burning the chest due to secretion of extra acid, its effect you can watch through this picture, that how it is destroying our mucus in the stomach. Now you are watching the stomach, that is a normal stomach, healthy mucosa, gastritic affected stomach, that is inflammation of the lining. You are watching that. Now we will discuss the after effects and symptoms of gastritis. So we will go for these items, like symptoms of gastritis: vomiting, stomach burn, upset stomach, loss of appetite, blood vomiting, black stool. You all know most of the facts about gastritis. These are the basic symptoms like vomiting, stomach burn. Okay, so now we will know it causes burning and bad feelings in the belly or the chest. So you are watching the pictures here, burning the chest or belly, that is very bad effect. Burning sensation is felting throat and pain in the stomach. You know this type of pain when you go through it, right? So if timely treatment is not done, ulcer may form in the stomach and the intestine. It is called gastric ulcer. So you are looking a picture where the stomach is affected by the secretion of acid. Now we will know the remedy of gastritis. It is very important to know how we will deal with this type of disease. So we need to know firstly that the disease can be prevented by taking meals timely. So we need taking meals timely. Then avoiding too much spicy foods. Too much spicy food need to be avoided. Taking or practicing healthy food in regular meal. So you are looking some healthy foods, please try to take this in your regular meal. Dysentery, well-known disease in our country, and these are two types like amoebic dysentery and bacillary dysentery. So we are very known with it. Amoebic dysentery, when amoeba, a unicellular organism, enter into human intestine, creates diseases like this. So basically what happened, amoeba, a unicellular organism, it enters into our large intestine and then they create a mass. Like you are watching the amoeba in the first picture, it attack the amoeba you are watching in the first picture and it attacks the large intestine, and after that it creates a dysentery disease. How spread? Basically wild animals defecation through soil or through water go into the fruits or vegetables. After that, when human being takes it, it becomes a very big mess to us and then we affected by it. Now the symptoms of the disease are pain in the abdomen and mucus or bleeding with stool. So basically we feel pain in the abdomen, right? And then the mucus or bleeding with stool, that reflect definitely you have affected by dysentery. Now we will discuss about the preventive measures that we can take against this dysentery, like drinking water from the tube well or boiled water. So tube well water or boiled water, this is safe for us. We can take it as a preventive measure. We can also go for the filtered water, that will be also beneficial for us against this type of disease. Now we will know that taking care so that water and vegetables are not contaminated. We need to be confirmed that we are taking the vegetables that are not contaminated somehow. Like earlier I have told you, from the soil also the germ can go through our vegetables to our stomach. So we should be careful about that. Saving foodstuffs from flies and cockroaches are the measures that can prevent infection of these diseases. So when flies and also the cockroaches attacks our foods, we should be very careful. We should cover our foods all the time. And next, we need to be conscious about this topic, that infected patients should seek doctor's advice and take proper medicine as a remedy. To get recovery from the amoebic dysentery, you definitely need doctor's advice and also regular medicine. Now we will go for bacillary dysentery. What is bacillary dysentery? When Shigella bacteria attacks intestine, causes this type of dysentery. This germ attacks epithelial layer or large intestine, and then we get attacked by it. Here you are watching some pictures of that Shigella bacteria. Look at these different type of pictures. All are Shigella bacteria, first, second, third and fourth. A group of Shigella bacteria here. Now how they attack? Shigella bacteria attacks the epithelial layer of large intestine. Look at this picture. Here you are watching the large intestine, and the Shigella bacteria basically attack that part and destroy the layers of that large intestine, and for this reason we suffer from this disease. Now we will know what are the symptoms or after effects of this disease. Here, as a result, repeated defecation with stool mixed with mucus will happen. Occasional bleeding occurs, so it is called blood dysentery. Now here need to be noted that this is blood dysentery. In Bangla what we say that rokto amashoy. Okay, now what can be the preventive measures? One should not neglect the disease. Treatment according to doctor's advice is essential. This disease can be prevented when one follows the general health tips. Otherwise, you will not recover from this type of disease so easily. Now our topic is constipation. What is constipation? We will discuss the meaning, causes, symptoms, complications, treatment, medicines and relief. Look at the picture. Constipation occurs where? Constipation actually is not a disease. It is a phenomena that can happen to our body. Now, what is constipation? It is a question. Decrease in the frequency of fecal elimination, passage of hard, dry, sometimes painful stool. So normal range from 3 times daily to 3 times per week. Now we will discuss why we suffer from this. Constipation has various causes such as slow movement of food through intestine, not taking green foods and vegetables. So as we know, slow movement of food through intestine that can cause constipation. Not going for defecation when feeling for defecation comes, etc. These are the symptoms of constipation or the after effects of constipation. Now we will know that what could be the preventive measures that we can take. Making habits of clearing bowls regularly, taking vegetables, fruits. Look at the pictures. These are the proper foods that we can take in our daily meal. Foods containing dietary fibers can remove these difficulties. Look at the picture. Here we are showing you that type of foods or food items which contain fibers, and that is very effective for our health. Now, care of digestive system. The total digestive system will be good and effective if you do proper judgment with it. That means proper food and also the timing of taking the foods. Now we will know one by one. Here, tooth. Teeth should be brushed and cleaned after every meal, right? So, food particles that stick to the teeth gap get rotten and spread bad breath. It causes dental caries. One should not take too much sweets. Sweets are responsible for dental caries, right? Now, in this picture, you are watching so much food, sweets, very colorful sweets that makes your mind very cheerful, but you cannot take it too much. Okay. Now, foods should be clean and boiled properly. You should clean the food properly, like vegetables and also the meat items, and boil properly also. Stale and rotten foods should not be taken. One should not take this type of rotten or stale foods. Then one should cut nails regularly, whereas plates and other crockery and hands should be cleaned before taking meals. So when we are maintaining our health, we need to know what type of activities we should do regularly. Then, taking food. Meals should be taken in timely, regular. Do not eat much. Always take balanced food. Drink sufficient water after some time of taking meals. So, when you are taking food timely, it is beneficial for your health. Now, another thing you should remind that always drink boiled water after cooling. Take food chewing slowly. So when you are taking food, don't take it in a very hurry. Okay? One should not take much spicy and oily foods. You should take the food that keep your heart and stomach healthy. Now, my dear students, let's enjoy a video on this topic.
What is Crohn's disease? Crohn's disease is a chronic condition characterized by inflammation in the gastrointestinal or GI tract, which is also known as the digestive tract. Since Crohn's disease is a chronic illness, it is persistent and will be present throughout a patient's life. However, patients and physicians can work together to manage the symptoms of this disease. The GI tract includes the mouth, esophagus, stomach, small intestine, large intestine, and anal region. Crohn's disease can affect any part of the GI tract, but the most common location is the last part of the small intestine, which is called the ileum, and the first portion of the colon, which is also referred to as the large intestine. Current thinking is that Crohn's disease is a genetic disease caused by abnormal regulation of the immune system. The GI tract is frequently confronted with bacteria from our diet and environment. Many factors can contribute to a person's risk of having Crohn's disease, but most can be thought of in three categories: genetic predisposition, environmental factors, and a dysregulated immune response in the GI tract, which causes inflammation. Environmental factors that may contribute to Crohn's disease include infections, smoking, and taking antibiotics or anti-inflammatory drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. One way that the body can protect against potential bacterial threats is with inflammation. We are familiar with how inflammation looks on the outside of the body, for example, when you have a scrape or a cut. That scrape or cut becomes red and inflamed as a result of the immune system trying to get rid of any bacteria and viruses that are in the wound. After a few days, when the immune system has finished its job, it turns off, so the redness and inflammation disappear. In Crohn's disease, inflammation, ulcers, appear within the GI tract, and the immune system works to combat the bacteria and viruses in the same way as with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it has gotten rid of the bacteria or virus, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of Crohn's disease. The symptoms of Crohn's disease vary depending on where the disease is located and its severity. This means that every patient with Crohn's disease experiences the disease differently. Most patients with Crohn's disease have abdominal pain and diarrhea. Other symptoms related to the GI tract can include abdominal tenderness, loss of appetite, weight loss, fever, fatigue, rectal bleeding, anal skin tags, and ulcers. In children, Crohn's disease may result in stunted growth and a failure to thrive, even if GI symptoms are not present. In addition to symptoms involving the GI tract, Crohn's disease can affect other parts of the body. Symptoms outside of the GI tract can include joint pain, liver inflammation, osteoporosis, skin problems, eye problems, mouth ulcers, and anemia. Patients with Crohn's disease should expect to lead normal lives in consultation with their healthcare providers. The goal of the healthcare provider is to help people manage Crohn's disease, rather than having the disease manage them.
Dear students, I hope that you have enjoyed the video. Now take the related questions. What do you know about gastritis? How could you prevent yourself from gastritis? What is gastric ulcer? Discuss about the types of dysentery. How could you take care of digestive system? So these are the 5 questions I have given you, and these are the homework of your today's lesson. Now I will provide you one video on diseases of digestive system. You will follow it. That's for today. Thank you, students. Dear students, this is for today. Hope you will do your study properly. Thank you all.